Good morning. Welcome, everyone. I am very excited to welcome you today to our senior seminar series, which are now being held on a quarterly basis. The purpose of these seminars is to help our residents learn more about important topics that pertain to them, such as the topic we will be talking about today, Minority Health Month. Every April, the U.S. Department of Health and Human Services of Minority Health observes National Minority Health Month to raise awareness and highlight the importance the health of racial and ethnic minorities. Minority populations continue to lag behind the white population in a number of areas, including quality of care, access to care, timeliness, outcomes, as well as they face problems with provider biases and health literacy issues. We are very excited today to welcome our speaker to today's seminar, PrimaryOne Health Chief CEO, Charleta Tavares. Charleta is a tireless advocate at the local, state, and national level in health and human services, cultural competency, and health equity areas. She will be discussing today not only the incredible services that are provided through primary care, PrimaryOne Health, but also how they are working so hard to address minority health here in Franklin County. Before we get started, I just want to do a quick reminder regarding the Q&A feature in which you can ask questions of our speaker. Please feel free to submit your questions into the Q&A and we will get those answered either during the presentation or we can do it at the end of the presentation. Please make sure your questions do not contain any confidential information as this is a public event. So with that, I really look forward to our speaker today, and I'm going to turn it over to you, Charleta.
Thank you very much, Caroline, and I want to thank you and the Franklin County Office on Aging, and certainly your director, Chandra Wingo, for all the work that you're doing to assist our residents on senior issues, older adult issues. I know that many are trying to find the best I don't know whether we want to say nomenclature to address older adult issues within Columbus and Franklin County. But I'm happy to be here. Next slide. And to talk a little bit not only about PrimaryOne Health, but also about why we're working so hard to address the inequities, which is really why the Office of Minority Health here in the state of Ohio, the Ohio Commission on Minority Health, the U.S. Department of Health and Human Services, Office of Minority Health is really trying to address the inequities, the disparities in health outcomes amongst African, Black, Latino, Hispanic, Asian, Pacific Islander, Native American populations, and the Caucasian white population. But I'm going to give you a little overview about PrimaryOne Health and what we're doing to address the inequities in health throughout our communities, not just in Franklin County and throughout the state of Ohio, but throughout the country of the United States. So we're going to start with who we are. And next slide. Next slide. We have a broad vision, and our vision is that we really want quality health care for everyone, addressing, again, inequities, disparities, where there are different outcomes for one population versus another. And that's a very, very broad vision. However, we, PrimaryOne Health, we focus in on the mission of our organization that is really focused in on individuals and families who are experiencing financial, social, or cultural barriers to healthcare. And as an organization, we really zero in on our values, respect for each other, our team members, respecting each other, respecting the patients that we serve and the community that we serve, quality, compassion, and service. Next slide. Next. I don't know if it's not moving. Oh, there we go. Our history. We have over 50 years of community health centers in Columbus and Franklin County, because remember, Columbus is all in Franklin County and a couple of other counties. But we started over 50 years ago with the first community health center being established in 1973. We had 7 independently operated health centers. They each had their own board of directors, independent in the way they operated. They were all being funded by the city of Columbus, and we certainly thank our partners with the city of Columbus. But one of them became what's called an FQHC. That's a designation by the federal government from the U.S. Department of Health and Human Services, Health Resources and Services Administration. That designation ensures that you are following over 19 standards and many, many other subcategories. So it's a designation that's given by HRSA, the Health Resources and Services Administration. Only one of those 7 health centers back in 1973 and then in 1996, only one of them was an FQHC, a federally qualified health center. That health center was having some financial difficulties. And so the federal government came in and said, if you don't do something, we're going to take the federal dollars away that was going to that one health center. So they reached out to the only other funder of all 7 and said, if you don't do something, we're going to take the money away. The City Council Chair of Health and Human Services, the Columbus Health Commissioner, they decided they were going to create a new nonprofit. They called it Columbus Neighborhood Health Center, Inc. They took 3 board members from each of the 7 health centers and created what was then called Columbus Neighborhood Health Center, Inc., and created a system of 7 centers. In 2015, when I joined PrimaryOne Health, in 2015, I worked with the board and a marketing firm. We changed our name to PrimaryOne Health to really reflect on being one system of care with many sites. At that time, it was about 9 sites, and we then started operating as a system. We expanded beyond Columbus in 2014. We went to Dublin, and many people thought, why is a federally qualified health center that really focuses in on the vulnerable populations who may be economically challenged, be immigrants, refugees, racial ethnic populations, underrepresented communities? Why would they go to Dublin? Dublin's a wealthy community. What we looked at was free and reduced lunches. And we saw that the population within the school system was very high of little children who were on that free and reduced lunch program. We also wanted to provide mental health and substance use disorder services for our residents and for our patients. And so we partnered with Centero, which is a behavioral health organization, because we were not providing behavioral health services at that time. So we moved in with them. We provided the primary care and they provided the behavioral health care. We also moved beyond Franklin County in 2014. We partnered with a private, at that time, nonprofit hospital called Berger Hospital. It has since been acquired by Ohio Health, so now it's called Ohio Health Berger. We have a site in one of their administrative buildings on the campus of Berger Hospital. Next slide. Next slide. So we now have 12 health center locations, 11 in Franklin County and 1 in Pickaway County, and we were able to get 4 mobile health centers through the funding from the CARES Act and the ARPA dollars, or the American Rescue Plan Act dollars, so that we could expand our footprint, but more importantly, serve underserved areas of Franklin County and Central Ohio. We also have a corporate headquarters, which is out off of Airport Drive near the airport. Next slide. Here are 6 of our locations. We have them, as I said, throughout Franklin County. We have many partnerships. One of the newest locations is that 4661 Sawmill Road. And the reason we moved there and moved out of the location with Centero, they grew, they needed more space. We grew, we needed more space. It was their space. So we decided we were going to move out of their facility, and we had started providing our own behavioral health services within our primary care locations. So we found a spot right there at the corner of Bethel and Sawmill Road. It was located more in line with where our patients were coming from. Lots of apartment complexes on Bethel Road and going down Sawmill Road. And so that's why we located there at Sawmill and Bethel. It's also in the triangle of Upper Arlington, Dublin, and Columbus. Next slide. These are additional locations. I do want to highlight two. One is the 600 North Pickaway. That's the Burger Hospital location. And then the bottom location, 720 East Broad Street, that's a partnership with Southeast Healthcare. We had a behavioral health organization that was going under back in 2019, 2018, and the Franklin County Adam Board CEO reached out to me to see if we would be willing to provide services for those patients who had lost their care provider. I said yes, and certainly have to get approval from my board, but we knew that a large percentage of those patients had severe and persistent mental illness. So I knew that Southeast really specialized in serving individuals with severe and persistent mental illness. And so I asked if I could bring a partner to the table. The Adam Board agreed. We reached out to our designating agency at the federal level, HRSA, to make sure it was okay, because it was two federally qualified health centers moving into a same address, even though we had different suites, and it had never been done before. They agreed to that, which we were pleasantly surprised, because our community needed us to do this. And so you have two FQHCs at that 720 East Broad Street location. We also have partnerships with other organizations. If you look at the top right-hand column, we have the Livingston Avenue location. That's a partnership with Alvis. If you look at the 1791 Alum Creek, that's a partnership with Maryhaven. Those are two serving agencies in Franklin County that are providing wonderful services, and we are providing health care for their clients and for the community at large. Next slide. Those are our mobile health centers, and our tagline is driving good health to you, because these mobile units can go anywhere within Central Ohio. We establish partnerships with senior centers. We establish partnerships with social service providers, those that serve our older adult populations, as well as our children and our adults within our community. But we can take these mobile health units anywhere within Central Ohio. And we're happy to say that we partner a lot with Franklin County Department of Job and Family Services, so that they can bring their mobile unit. We can bring our mobile unit. They can provide information on all the services that our Franklin County government provides, and we can provide information and services. We have two operatories, two exam rooms on each one of those mobile units, a waiting area, and it's wheelchair or accessible for developmentally disabled populations. Beautiful services, and we provide the primary care, as well as soon we'll provide dental and vision on one, a dental mobile unit and a vision mobile unit, probably within the next year. Next slide. We have about 330 employees. And out of those 330 employees, 92 are practitioners. So you have doctors and nurses and nutritionists and clinical pharmacists, and we'll talk a little bit more about pharmacy in a minute. And we also have behavioral health clinicians, social workers, physical therapists. Those are all included in those practitioners. Our board, and this is really unique as a nonprofit, one of the requirements of the federal government in order to be designated a FQHC is that the majority of your board members, at least 51% of your board members, must be from the patients you serve. So out of our board, we have a 16-person board of directors. Out of those 16 board members, 10 of them are patient board members, and then 6 of them are non-patient board members. So we have more than 51%, and that's a good thing, because they really want to make sure that the people that we serve, that we say we want to serve, that they are the ones directing where the services are located, what kinds of services you're going to provide, and hours of operation. So the board is instrumental in deciding what we do, where we go, who we serve. And we have patient board members at all ages. We've had patient board members as old as 78, I think was the oldest. But we really believe strongly in having a board that reflects the populations that we serve. And that's important because you want to hear from your patients, what are we missing? What new services could we provide? And we're really focused, laser focused right now on identifying as many geriatric providing practitioners as possible so that we are providing the best services for older adults as possible. We also have what's called a special advisor. That's an individual who comes to our board meetings. They do not vote, but they are a representative of the city of Columbus since they're one of our funders. Next slide. These are some of our services. You'll see some asterisks on cardiology and teledermatology. Physical therapy. Those are collaborations with The Ohio State University. We also provide behavioral health and mental health, substance use disorder, and physical therapy ourselves, but we're also a site for residents to come and do their clinical rotations. So we're really proud of that. We provide dental, we provide vision. As I said earlier, dietetics. We also have clinical pharmacy. Our pharmacists are rock stars. They provide clinical medication education and really help people to understand the medications that they're taking. They will review the medications that our patients are taking to ensure that they work well together and to make sure that the dosage is correct. We also have physical therapy at one of our locations. We can do some stretching exercises and other kinds of physical therapy without the equipment, but the equipment is located at our Parsons Avenue location at 1905 Parsons Avenue. We also provide what's called enabling services, translation and interpretation services, and transportation. Vision services, as older adults know, sometimes the eyes start to get less clear. And so we have a wonderful vision director and optometrists who are working very hard along with their tech teams to ensure not only that you get your eyes checked, but that you get the right prescription glasses. And we have a dispensary for glasses as well at our locations. Next slide. Next slide. Financials. These are 2021 and you wonder, well, this is 2023. Well, we have to wait until our board approves our audit before we can start sharing our 2022 revenue and expenses. So as of 2021, our revenue was about almost $44 million. And the vast majority of that money came in through patient service revenue, which is the revenue we generate from the payers, the insurance products, Medicaid, Medicare, and etc. Next slide. These are our expenses. You always want your expenses to be less than your revenue so that you save some for a rainy day. Our expenses, the vast majority goes to personnel costs, salaries and benefits for the team members that are serving our Franklin County public. We also have expenses on pharmacy because we have a 340B pharmacy discount program. We also have to pay for the operations, the leases, the rent, the utilities, etc. of those locations that we are providing services. Next slide. Next slide. This is just giving you some statistics over the last few years from 2016 through 2021. And you can see we were at 38,000 plus in 2016. We grew to a high of 48,000 patients in 2019, but then COVID hit. So we lost a lot of patients because patients didn't want to come in. They were fearful. And then we had staff that had to stay home with their children. So we're slowly building those numbers back up. And you can see the same with the patient visits. Next slide. These are our demographics. And I think this is really important for all of us to take a look at. We serve our Franklin County population. Disproportionately, we see more racial ethnic, which goes to our focus on Minority Health Month because disproportionately individuals from racial and ethnic populations that we talked about earlier are economically challenged, come from immigrant and refugee communities. And so that's who we are focusing our time and attention on, because we want to make sure that everybody gets quality health care. I got a question. What is the most challenging issue your team is facing with caring for older residents? The most challenging issue we're facing is finding clinicians, doctors, nurses, optometrists, physical therapists, and others, behavioral health clinicians, social workers that specialize in serving older adults. And I'm working with the Ohio University there in Athens and at their Dublin location to really see if we can develop a pipeline of young people who are going into the various fields of medicine and focusing in on getting their certification in serving older adults, because we need people who understand the body, the health of older adults, how best to serve individuals who are growing older that may be a little more frail. So as you see in our demographics, you can see that we serve a large percentage of patients who speak a language other than English as their primary language. 38% of our patients have a primary language other than English, and you can see a large percentage of our patients are Hispanic Latino. Large percent are African, and I say this specifically because we have Somali, we also have Ethiopian, we have Nigerian, we have various countries of Africa represented in that African and Black American population. We also serve a majority of female patients, and as we really look at our older adult populations, you will see more older adults that are women than are men. Unfortunately, our male populations tend to die earlier than our female populations. And so that's a statistic that carries on not only for older adult women, but also males don't seem to come into their primary care physicians as often or at all. And so that's why you see the difference in the numbers, that almost 2/3 of our patients are women and 1/3 male. And then you can see the other statistics. We have what's called a healthcare for the homeless program. It's a special program. We go out on the land and serve individuals, a large percentage that are older adults that have found themselves homeless because of economics. And so our healthcare for the homeless team, about 3% of our population, around 1,200 individual patients annually that we see who are homeless. And then you can see the other breakdowns. We have LGBTQ plus patients. We serve everyone, and we're proud of that. Next slide. This is our 340B pharmacy discount program. This is a program that's for federally qualified health centers, some hospitals that serve a disproportionate number of residents who are economically challenged or who receive their health care through Medicaid, your CareSource, your Molina, your United Healthcare, your Buckeye, and other managed care plans. This program was specifically set up for those entities. Some hospitals that have a large percentage of Medicaid patients, so their patients could get prescriptions at the lowest amount possible. And what we're proud of is that we've grown the program. If our patients go to contract pharmacies, we save them millions of dollars. And you can see over the course of from 2016, as we really started pushing the program amongst our patient population, how many millions of dollars they've saved, a high of 16 million, almost $17 million in 2019. And then there was a drop because of COVID, and now we're growing the program again. We have a wonderful director of pharmacy. Her name is Olivia Nathan, and Olivia is really helping us not only with our contract pharmacies, but we're going to start developing in-house pharmacies. So when you come to our locations, you don't have to go to another location to pick up your prescription. you will be able to pick it up in the future right there at PrimaryOne Health locations. Next slide. Our strategic goals and partners. We go under a strategic planning process every 3 years or so. We went through one in 2020, in February of 2020, and then COVID hit in March of 2020. So we had to modify those strategic goals for that 3-year plan period. Those goals have maintained. We had a strategic planning retreat in 2022, and we came up with our strategic goals. We maintained growth, strategically grow where there's a need for services. Strength, we want to be strong financially. We want to make sure that the organization is sustainable. Choice, we want to be the choice for our patients and residents of the community, but we also want to be the provider of choice for partners in the community. Franklin County Office on Aging, Franklin County as a total entity, and we've got partnerships with the Franklin County Office of Justice Policy and Programs. We've got partnerships with the county commissioners. We've got partnerships with Job and Family Services. We want to be a partner with many organizations throughout Columbus, Franklin County, and Central Ohio, because we can serve our residents better. And then we want to put service as a top-notch goal. We want to provide the best services, so not only do our patients come back, but that more residents will come to our locations. Next slide. These are some of our top strategic priorities: customer service, facility investments, financial stability. Everybody wants to be good fiscal stewards, compliance with all the regulations at the federal, state, and local level. And as I said, partnerships and community engagement. Next slide. These are just a partial list of our partners, and we're really proud of these partnerships. But this is a partial list. As you see, you'll see Franklin County. We're a strong partner with Franklin County Board of Health. It's really important because we're a healthcare organization. We are partners with other FQHCs, with all the hospital systems, with all the social service agencies like your settlement houses that provide wonderful services for older adults like St. Stephen's and Central Community House and Gladden. Those are wonderful partnerships to serve our residents in the various geographic areas. Next slide. Next slide. These are 2021 accomplishments, and we're very, very proud. We're Franklin County's oldest and largest community health center. We were the first and only for a number of years, and then we started growing federally qualified health centers, and those are our sister organizations that we partner with as well. In 2021, we received over $29.4 million in grants, and 21 of those grants were brand new grants. Some of them were continuing grants, but we are very proud of that. We broke ground on the new Alum Creek Health Center, and we want to share that the County of Franklin has been a great partner. They provided funding. We're going to have an open house this summer, and we will certainly make sure that our Franklin County Office on Aging has that information. It's a beautiful facility. The facility that we were located in, that we're currently located in at Maryhaven, they need their space back, and we need more space. So we were asked by Alvis, and I talked about them earlier, that partnership on Livingston Avenue. They're closing that site because they've expanded on their site on the Maryhaven Alvis community-based correctional site, community-based corrections facility on the Alum Creek campus. And so they asked us to be a part of that new facility. So we're going to have a brand new location there, and we'll have the opening this summer. It will also provide dental and vision, as well as behavioral health and primary care. We also opened 2 new mobile health centers in 2021. 2 in 2021 and 2 in 2022. We had a successful financial audit, and I must say, since I've been the CEO, we've had successful financial audits every year that We've been in business since I've been here in 2015. Fully vaccinated staff. We hired 136 new employees. You can see we did a lot of testing in 2021. We did a lot of when we started receiving the vaccine in 2021 and certainly in 2022, we provided lots of vaccines. And then we also started a new healthcare justice scholarship program. And this is important because what we're trying to do is develop our own pipeline of individuals from racial, ethnic communities to serve in healthcare in the various professions. So we started raising money in 2021 for a healthcare justice scholarship fund. And these are for individuals. The application opened up this year because we wanted to seed it in 2021. We put more money in 2022. At our Healthcare Justice Award event in November, we're going to award those scholarships this year. And we're proud to say that we're getting lots of people sponsoring and making donations because we, again, want our healthcare environment to reflect the populations that we serve. Statistics have shown that we get better health outcomes when we have clinicians, doctors, nurses, pharmacists, nutritionists, physical therapists, dentists, as well as optometrists who come from the communities that they're serving. There's a better appreciation and understanding about the backgrounds and the lives of individuals that come out of the same communities. And so stats have shown that you can reduce the disparities among racial and ethnic populations when you grow a larger pool of service providers that look like them, that come from those backgrounds of being from Somalia or being from Nepal or other communities from Mexico, from Guatemala or Puerto Rico, if you have individuals that understand the language, understand the culture. So that's what we're doing with our Healthcare Justice Scholarship Program. Next slide. Next slide. In-house pharmacy, I talked about that a little bit earlier. We believe that this will provide even better outcomes for our patients if they don't have to be transported or go on their own to pick up their prescriptions at a contract pharmacy. We will keep those contract pharmacies, but there's been such an attack by third-party administrators and manufacturers on working with contract pharmacies, which is something that is really hurting our opportunities for growing our pharmacy program and saving our patients money, that we've decided we want to start having in-house pharmacies in addition to those contract pharmacies. This way patients can choose to pick up their prescription right there as they're coming out of their visit with their doctor or nurse practitioner or their nutritionist or dentist, and that way they can have a one-stop shop. Next slide. 2 school-based health centers. We will open this summer 2 school-based health centers, and you ask, well, what does that have to do with older adults? Well, it has a lot to do with older adults because even though these 2 new school-based health centers are in school facilities, they're open to the public. We're going to have one at Groveport, Madison, which is outside of the city of Columbus, again, trying to serve as much of Franklin County as possible. It will be in what used to be the bus depot for the Groveport, Madison schools. They're creating a wellness center, and they'll have all kinds of social services, and they ask us to be their partner for health. So PrimaryOne Health will have, and we'll be opening that this summer as well. So we'll send that to the Franklin County Office on Aging. It is open to the students, the faculty, the staff, and the community. It will have its own entrance, so moms and dads and grandmothers and grandfathers can come to that facility as well. We'll also open a new school-based health center at the Global Academy up off of Carl Road with Columbus City Schools. And this one is also open to everyone, to the students, the staff, the faculty, and the community residents. It has its own entrance as well. So again, we're looking at all kinds of models of care to serve everyone within our community. Next slide. Now we're at that question and answer, and I know there's got to be more questions from our viewing and listening audience, and I'm happy to take any of those questions. Caroline or anyone, if they have questions yourself, please feel free to ask those.
Yeah, I think we may have lost Caroline, but I did have a question. I was just curious. What languages does your translation services cover?
We cover about every language, because if we don't have live interpreters, we have individuals who use a partner online service, and it's a live person, and we just let them know the language of the individual coming into our health center site, and they pull it up on the screen, and then that person does the interpretation for the patient and for the practitioner.
One question I also had too was, what's the best way to approach, an older loved one who may have hesitancy towards the healthcare system? For instance, there has been some resistance, maybe getting the COVID vaccine. What's the best way for someone to talk to their loved one about that?
Great question. Amy, it's really important that we share with our loved ones the reason we're asking them to get the vaccine or to get the test. We want them to live as long as possible, and we want to ward off any diseases or illnesses. And so as we get older, our immune systems are not as strong as they used to be. When you're younger, you go outside in the winter and you don't have your coat on. You don't pick up as many bacteria and viruses when you're young and really strong and your immune system is strong. And so when we talk to, and I am a caregiver to an older adult aunt, as well as I took care of my mom before she passed. It's important that we go with our older adult loved ones, those that need a little more assistance, so that we hear what the physician or the nurse practitioner is saying, and then to make sure it's understood by our older adult loved one. If we're going into our practitioner by ourselves as an older adult, we've got to make sure that we ask the questions. And that's the other reason it's good to always have another set of listening ears, to make sure we're hearing the same thing, to make sure that we get clarifying questions answered. And so there's no shame in going to a physician or a nurse practitioner or to your primary care setting and taking somebody with you. I just recently had a friend that was going through breast cancer, and I insisted in going with her to those appointments to make sure she had somebody that was listening a little differently, because when it's you that has an illness or a disease, sometimes we hear what we think we want to hear. When you have an objective person who is listening in a different way because it's not them, then you all can compare notes, and maybe they can ask some clarifying questions. So we want people to be comfortable with their healthcare practitioner. If it's not the right fit, to feel free to always ask if you can see another practitioner, because you got to build that rapport. So that way you're listening to the practitioner, the physician, the nurse practitioner, the dentist, etc., but also you are paying attention as much as possible to what they're saying.
Thank you. That's good information to have. I know we all, when we have those concerns, it's for the best for our loved one. That kind of segues into another question, which is older adults who may be afraid asking for help or have a fear of that stigma for asking for help, whether it be, physical help or mental health. Again, how is are we? What's your advice to talking to them and letting them it is okay to ask for that help?
Absolutely. I think one of the things that I would share with anyone that's a caregiver, anyone that's an older adult, I would always make sure that you understand what that practitioner is saying. Ask those clarifying questions, and particularly if you've got concerns about your own mental health or the mental health and well-being of an older adult that you're a caregiver for. Ask, what is the best way to serve them? For us, we think having an integrated healthcare model, you don't have the stigma. You're going to your doctor, or you're going to see your nurse. They don't know whether you're going to see the nurse for a mental health disorder or a substance use disorder, or just a concern that I'm feeling lonely, or I'm a little anxious, or I'm depressed. No one will know, because you're just going to your healthcare provider. And that's the beauty of having a federally qualified health center. I'm a little biased, but having the integrated model. So that way, whatever your issues are, the doctor, if you're going in for a primary care visit, maybe you're going in for your annual exam, and the doctor notices something, or your nurse practitioner notices that you're a little down, they can call in one of our behavioral health clinicians into the exam room to talk to you, to see if there's something that you should be made aware of. And so we're trying to address the stigma so people don't feel like it is a part of your health. It's just the health of the brain or your emotional health. It's physical health, emotional, and behavioral health. It's really addressing the whole needs of individuals. And one of the beauties, and I do need to share this, of being a patient of PrimaryOne Health or another FQHC, is that when you're a patient of ours, if you go into an assisted living facility, or or a rehab facility because you fell and you're going through rehab to get your strength back, your physician or your nurse practitioner from PrimaryOne Health can come and visit you because they know you. When you go into those facilities, the doctor or the nurse or the physical therapy specialist are working on behalf of that agency, not on behalf of you. And so having your own physician to be able to consult with that assisted living doctor or the long-term care facility, if you had to go into a long-term care facility temporarily or permanently, you could still have your primary care physician or nurse practitioner come to that facility and work with that physician of the facility to give you the best treatment possible. And that's a huge advantage, because if you're a permanent resident of a nursing home or a long-term care facility or an assisted living, they're going to have you see their physician or their nurse practitioner. And it may be somebody who has never seen you before, and they're making assumptions based on your age.
Thank you for that. We do have another question. It's what is the biggest need for older adults in Franklin County?
I think the biggest need for older adults in Franklin County and counties throughout America is having geriatric specialists to see them. And that's why we're really encouraging all of us to groom and grow more specialists to see older adults. We have very few in Franklin County, very few throughout the country. It's a specialization to better understand patients as they mature, as they have different kinds of needs and may have cognitive differences, hearing differences, frailty, so that we're not assuming people can do X, Y, and Z. We're not assuming that just because somebody is over a certain age that they can't hear or that they can't see or that they're not able to make decisions for themselves. We want people to work with adults as they age so they see the changes that might be taking place. And that's what geriatric specialists in all professions can do.
Perfect. We have another question. Can you provide some additional information on the collaboration with Ohio University and the increasing number of physicians who are certified to work with older adults?
Absolutely. It's a collaboration that we're just starting. We had attempted it a couple years back before COVID, and we were really moving along with Ohio University. And then that faculty member left, that dean retired. And so now we're building the relationship all over again. But what we're really looking at is having OU place a faculty member in PrimaryOne Health as an example, and then they work with the students that are going through the geriatric program at PrimaryOne Health as they finish up their rotations and their curriculum. And so that way they get to work directly with patients with a faculty member that would monitor and help them not only with their services and their practicums, but also help them with the curriculum.
Awesome. That is exciting news, and we can't wait to learn more about that. I think Caroline is back on, so I will hand it over to her.
Thank you very much, Amy.
I am. Can you hear me, Amy?
Yes, we can hear you.
Okay, great. I was in Charleta. I cannot thank you enough. The information you shared is so exciting for what you are all doing, the work with Ohio University, and just what you are all doing in the communities, and serving not just our older residents, but all of our residents. It's very exciting to work with you, and I can just share, from Franklin County Office on Aging, we have collaborated with you and Dr. Nathan to ensure our older adults are getting vaccinated, and you have all been just an incredible partner. And so we so look forward to working with you in the future. But I just want to, again, thank you so much for this incredible information, all that you and PrimaryOne Health are doing for our community. And again, just saying a big thank you.
You are quite welcome. And I did share with you our last newsletter. A new one will be coming out this month. And then our service brochure. So if you want to share that with any of the partners that are online.
We will do that. And this presentation, I know we will have online, and we will be able to share it with you as well.
And we will do the same.
Okay. Thank you. Thank you again so much.
Thank
you. Have
you.
a wonderful day.
You too. Bye-bye.